Hey everyone, today we are going to talk about the bundle branch blocks, right and left. This is the second lecture on the ECG, and if you have not already watched the abnormal and the normal P-wave ECG findings, view them by clicking the card above. Now, before we move to see the findings in the abnormal ECG of the bundle branch block, as always, we need to first discuss about the normal QRS complex. Particularly, we talk about the QRS complex here because the bundle branch has manifestations in the ventricles, and therefore we talk about the QRS complex. Now, we use generally the chest leads to differentiate between the right and the left bundle branch blocks. You would see as we move further, and the normal QRS complex duration is between 80 to 100 millisecond, and this is very important point because this helps to identify the bundle branch block. Actually, this is the one of the criteria for identification of the bundle branch blocks. Because if it's greater than 120 milliseconds, then there is a bundle branch block, either right or left. Okay, so here I have kept a transverse picture of the heart with the lead V1 and V6. Now the chest leads, they show transverse. We use them as a transverse view of the heart, and V1 is and the V6 are generally preferred because they are most away from each other, and hence they have a contrasting features. Okay, so now I have kept these vectors according to their chronology, how they depolarize the heart normally, and this thing would happen first. This would be the second in the sequence. These are the third one. Okay, this would be the third thing to happen. First the septum depolarizes, then the apex, and then the walls of the free walls of the left and the right ventricles. Okay, now one thing I would like to say here, the principle over here is that we actually measure the resultant of both the vectors, right? So here in the first one, the resultant is towards the towards the right side, and that's because this one, the left dipole, is larger in size and magnitude because of course the left ventricle wall has more musculature, and that results in a greater magnitude of that vector. Now in the second one we have the resultant, the resultant is downwards only, and in the third one the resultant is towards the right side, not this much big. The resultant cannot be bigger than the original vectors, but just for the sake of showing the direction, right? So towards the right. Now what happens, let us plot the ECG in V1. As it starts, what happens is a positive deviation because this vector is towards V1, and in the starting for the V6 would be a negative deviation because that is opposite to the V6. In V2 it's perpendicular to V2, and hence we don't see any deflection. Now in when there is the second one, as the reaches to the base, it is towards the V2, and hence we see a positive deviation. No deviation in case of the uh, the V1 and the V6 because there is actual they are perpendicular to the this uh, vector, and again same thing over here. Now we have the third one. As the free wall contracts, this would cause a positive deviation in case of the V6 because V6 because there is the vector towards the V6, and this would cause a negative deviation in case of the V1 because it is opposite to it. Again in V2 slightly we can see that this vector is slightly towards the V2 and has some part in the V2, and hence we see a negative deviation in V2. Okay, so this is the normal picture of the V1, V2, and V6. More important is V1 and V6. Okay, now we are ready to begin our discussion with the bundle branch blocks. Now, what is the criteria for saying that this is the right bundle branch block? Okay, now the QRS complex, as I've already mentioned, that duration is very important in case of the bundle branch blocks, and this must be greater than 100, or it should be at least greater than sorry, it should be greater than 120, or at least greater than 100. Now, the characteristic finding most commonly seen with the right bundle branch block is the M-shaped QRS complex. We would discuss it in the next slide in a moment. And again, this another characteristic finding is the W-shaped QRS complex, particularly the R wave in case of the V6. Now, one of the findings is the slurred S wave, and the slurred S wave is sort of because there is the prolongation of the Purkinje fiber depolarization, and that is particularly seen in the lead 1, lead 2, and V6. Okay, so here I have kept the normal and the right bundle branch block. So we are going to again plot the ECG findings with the help of the vector. What is bundle branch block? The right bundle branch block, the delayed depolarization of the right ventricular, because the some block in the right bundle branch. So the left septal wall, obviously it depolarizes first, and that's then followed by the left free wall contraction, the left free wall depolarization, and the delayed right ventricle paraseptal region, this one paraseptal region, and this would be the free wall. Okay, this would be the free wall. Right, so let's plot now the ECG findings in case of the V1 at a moment. See what happens. First, we plot the 1, and this would cause a positive deviation in case of the V1. Okay, and now the second vector would cause a negative deviation. What happens to the third vector? Yes. The third vector would cause a positive deviation because it is slightly towards the V1. The fourth vector also is slightly towards the V1, therefore it will cause again a positive deviation. Okay, so this would for the V1. Let's plot for the V6. What happens in the V6? There would be, first of all, the activation of the septum from left to right as the vector 1 represents, and this would cause a negative deviation. Then there would be activation of the left free wall, and this would cause a huge positive deviation in case of the V6 because towards the V6. Now there would be a delayed right paraseptal region, and this would not cause a much deviation, but it would cause a negative deviation. Then there would be the right free wall contraction, the right free wall depolarization, and this would again cause a slight uh, negative deviation in case of V6. Right now, V2 is not that significant, so we would not be plotting for that one. Now, compare and contrast what happens with what has changed with the normal. Let's plot for the normal ECG also. V1, this would be for the V1, and this would be for the V6. So see, what can you say over here is a very important finding with this over here. Both these things, very important finding in case of the right bundle branch block, is that you see a M shaped, and here you see a W shaped. Okay, and this is a mnemonic, actually, marrow. Okay, marrow. We use a mnemonic called William Marrow. It's a very famous mnemonic that William in this William right. So William, L represents the left, and W and M. So W shaped in the left bundle branch block in the V1, and M shaped in case of the V6 in the left bundle branch block. M shaped in the V1, as we see, in the right bundle branch block, and W shaped in the V6. So a very important take home message is that M shaped in case of the V1 and W shaped in case of the V6. And the mnemonic for this would be marrow in the right, and William for the left one. So what I've explained so far is, let's again see what has happened. There is the depolarization of the septum predominantly from left to right, and this would cause a negative deviation in case of the V6 and positive deviation in case of the V1. Then there is the activation of the left free wall, and that would cause a positive deviation in V6 and a negative deviation in case of the V1. Then there is right delayed right paraseptal region depolarizing, and this would cause a slight positive deviation in case of the V1 and a negative deviation in case of the V6. Then finally we have the right free wall that depolarizes, and that would cause a negative deviation in case of the V6 and a positive deviation in case of the lead V1. Now let's see briefly the causes of the right bundle branch block. Now the pulmonary disease is one of the causes of the right bundle branch block. They can be COPD, the pulmonary embolism, or Cor Pulmonale. The right bundle branch may also be seen after the coronary artery disease or any atrial septal defect, cardiomyopathy. And Lenné-Gray-Lev syndrome is the fibrosis of the conduction system. Now this Lenné-Gray-Lev syndrome involves the Purkinje fibers and any of the bundle branch that may be right or left. Okay. Now this right bundle branch block may also be seen after some post heart surgery or post cardiac surgery, and this is quite relevant here because mostly because of the reconstruction surgery or any bypass, there is sometimes the right bundle branch block. Now, one of the finding with the right bundle branch block is that when the anterior MI is associated with the right bundle branch block, that has a poor outcome. Okay, this is the has a almost a worse outcome. Okay, now let's see about the left bundle branch block. And what happens in the left bundle branch block, as I've already stated, in bundle branch blocks, the QRS complex is greater than 120 milliseconds, and that is in, of course, in case of the complete left bundle branch block. It may be between 100 to 120 in the incomplete bundle branch block. Now, as I've already mentioned, because of the mnemonic, the William in the William-Marrow mnemonic, W shaped in the R wave in the V1, and M shaped in V6. We would be seeing by plotting this ECG in a moment. Now there is a absent Q wave in lead 1. Okay, and with my experience, this Q wave may not be seen normally even in normal ECG patterns. So this would not be the firm criteria, but these three would be very important criteria for stamping that it is LBB. Okay, so here again I have kept the normal on the left and left bundle branch on the right side. Now let's see what happens normal here in the left bundle branch block. That left bundle is blocked, therefore we have the right septal wall contract depolarizing first, and then we have small vector towards the left septal wall. Then finally we have the left free wall contracting. Now the 2 and 3 happen late, and that's why I've represented with the dash line. The right ventricle is slightly contracting earlier from the left ventricle. So let's plot the ECG findings. Now what happens in the V1? What happens is that the first vector is away from the V1. This would cause a negative deviation, and now the second vector is again away, and this will cause again a negative deviation. The third vector is again is away, and this will cause again a negative deviation. So here is the V1, right? Now the V3, sorry, not this is not V3, this is V6. This is a mistake over here. This is lead, chest lead V6. Okay, so what happens in the V6? There first vector plotting, there would be a positive deviation, then there would be again a positive deviation, then there would be again a positive deviation. Okay, so this would be for the other V6. Now here you can definitely see the mnemonic W M shaped, right? M shaped. So this is very important. Let me label these for the better understanding, right? Let me choose a color. Yes, 1. This would be the second one. This would be the third one. Okay, and this would be the first one, the second one, the third one. So just see what has happened here. This is indeed W shaped, and this is M shaped. W M shaped. William W for the W shaped in case of the V1, and M for the M shaped in the V6. Okay, from the William mnemonic, right? Okay, so what is the mechanism? Let's see it again. And there is the first depolarization of the right septal in the paraseptal region, as I've already mentioned, because the left bundle branch is blocked, and then there's a delayed left septal depolarization, the second vector as I represented earlier, and the late, very late free wall depolarization of the left free wall at that which I represented with the third vector. Now, what were the causes of the left bundle branch block? So usually seen, it may be seen after MI, and they may be seen after the left ventricular hypertrophy, particularly because of hypertension. Now, the Lenné-Gray left syndrome already mentioned because there is fibrosis and of the Purkinje fibers along with some bundle branch involved, dilated cardiomyopathy, with this aortic stenosis is quite associated with the left bundle branch block, and again the post cardiac or post heart surgery is another cause for the left bundle branch block. Now generally the bundle branch blocks require no treatment if they are asymptomatic and the patient is able to do the normal activities, the daily activities, um, and these bundle branches are usually then no, they are congenital, and otherwise if there is some severe problem or the ventricles are not contracting in synchrony, then we need a pacemaker, and usually a biventricular pacemaker is used. Now here I have kept the final picture of the right bundle branch block and the left bundle branch block, the normal sorry, the real picture of the ECG. Okay. Now, right. So now, two things I need to elaborate over here are that what is this RSR, and why they are small, they are large, and where is the QRS complex in this V1 lead. And the second thing I would like to tell you is the small thing, that incomplete bundle branch blocks. So what is this RSR? Okay, so you know what is R wave. Actually, the definition of the R wave is that any depolarization or any positive deviation after the following the P wave is said to be R wave. Okay, and any negative deviation following the P wave is called a Q wave, right? So the definition is not according to the alphabetical order, but it is according to the deviation. Positive deviation after the P wave is set R wave, and a negative deviation after the P wave is called as Q wave. And hence we know that there is a positive deviation in case of the lead V1 because of the first vector which we plotted, and that is towards the V1, right? And therefore we see a R wave because it is a positive deviation. Now again, what do we see? There is a negative deviation. A negative deviation following a R wave is called as S wave, and we see a negative deviation, hence we say it is S. Now this R, the capital R represents only thing that this small r, that the magnitude of the capital R wave is greater in comparison to the small r wave, and here you can see this is the capital R wave. Okay, and this is again a positive deviation following the P wave. Okay, and that's why we call it RSR prime, right? And the same thing you can see over here is that the small q because of the negative deviation, capital R because of the huge positive deviation, small s because of the negative deviation following the R wave is called S wave, right? And again, the most important thing, the mnemonic, the marrow in case of the RBB, this is M, you can imagine over here M, right? And this would be the not very clear over here, but just it's W, and here the we do not see very clear, William, that is W, but here we are definitely seeing the M, right? So this would is this is self-explanatory. R is here, this one, the R wave is mostly it's R wave, and we can say that R wave is notched. This is the S wave, and this one is S wave, and this is the R wave because you can see it is a positive deviation. Okay, so and these lateral and anterior are because of the view of the leads. The V6 is lateral and V1 is anterior, right? Now the second point, as I said, that incomplete blocks. Now incomplete blocks is actually when the those bundle branches are not completely blocked and allows some of the depolarization to occur. And those ECG findings are not important for the purpose of examination right now at this moment. So with this we can conclude our discussion on the bundle branch blocks, and hope you liked it. And do subscribe, share and like the video if you loved it, right? See you in the next one.